Back now on Try It Today, and boy, it's my pleasure to introduce this very special guest to you, and a return contestant on our game show here, whatever that means. JPAR Director, let's meet the lovely Dr. Elisabeth Stambaugh. She is an OB-GYN. It's with Pinewest OBGYN. That's a Cornerstone practice, and she is a very busy lady. We are just so glad she could take a little bit of her time out to come visit us here in the studio. Welcome.
Thank you so much for having me.
Good to see you. What are some of the recent advances in OB-GYN medicine which you think are most impactful for women?
Well, one of the most interesting things that has happened this spring is we've come out with new recommendations about how often a woman should get a regular pap smear to screen for cervical cancer. And it depends on the different ages, but when pap smears first came out, they picked a number out of the air and said women should get them yearly to try to detect early cancer and be able to treat it. And recent advances have shown us that that is not necessarily the ideal schedule, and so we're doing them less often, which is going to save us all money in the long run.
Sure.
But I think one of the most important things to realize is that we still need to have annual exams, but the actual pap smear
Exactly,
is
and I'm going to get to that later about the value of that, because it seems like every other week you're reading some group comes out with a study, oh, don't get a mammogram, oh, well, don't get a pap smear, oh, well, and it's these confusing messages that always seem to get out there, but you solve that by saying, look, I don't care what the message is, you need to get in here once a year.
Yeah, absolutely. There's a lot of prevention that we can do, and there's a lot of different things that come up for women at every different age, and we need to address those things on a regular basis.
All right, speaking of age, I'm glad you reminded me. I want to ask you something. How have the innovations in OB-GYN care changed in terms of the care that you give to different age groups? And I'm going to throw out 4 different categories here and get you to comment. Adolescents, we'll start with that.
Well, adolescents, we now have vaccinations for human papillomavirus, which is the cause of cervical cancer. And so adolescents, even before they are sexually active, should be getting vaccinated for human papillomavirus. Those
women of childbearing age, basically.
For women of childbearing age, there's a lot of prevention to prepare for whether they want to become pregnant or to try to avoid becoming pregnant if they desire. And also there's a lot earlier testing for genetic problems such as Down syndrome and other birth defects earlier in pregnancy, so we get them in a lot earlier.
I don't mean to put you on the spot. How early, when you say you can get it tested earlier to see if there's a problem with the pregnancy, how early is early?
Well, routinely now we do testing with a special kind of ultrasound looking at what's called the nuchal translucency, and blood testing that starts as early as between 11 and 14 weeks of pregnancy.
Oh man, I didn't realize that. And people should know about that, and just, I mean, is that, I know I'm going off script here, we had some things we wanted to talk about, but is that expensive, is it difficult, is it time consuming to go to all those tests?
Well, the exciting thing is that with blood testing, it's what we call sequential screening. It's 2 separate blood tests that are usually done at around 12 weeks and around 16 weeks, and we combine it with that nuchal translucency done at about that 12-week visit. We pick up more than 92% of chromosomal problems like Down syndrome, and that's non-invasive. It's a blood test and an ultrasound. It's not with amniocentesis.
It's just a finger prick, get the blood test. It's that easy, and it's so valuable. All right, very quickly, perimenopausal and postmenopausal folks.
Well, certainly over the last 10 years, 10 to 15 years, the controversies about hormone replacement and menopause have hit the news and are on the news just about weekly. And I think it's very important to have those discussions on an individual basis with the physician, because there's a lot of benefits to a lot of women from treatment of different issues that come up, both perimenopausal and postmenopausal.
What's on the horizon in terms of new treatments or procedures that will help your patients?
Well, the biggest excitement over the past 5 years or so has been the minimally invasive hysterectomies that we do, both with just straight laparoscopy and also with the robot, the Da Vinci robot that we do, to try to give women better outcomes with lower risks and also much easier recovery.
And of course, we talked about earlier the importance of getting a regular checkup, because women historically are, you know, they want to take care of themselves, take care of others. They're caregivers, they look after the kids and the husband, and even if it's a working woman, and they sort of put their needs aside, and we've got to change that.
Absolutely, because if they're not healthy, then they're not going to be around to take care of all those other people, the parents, the spouses, the children. So they need to take care of themselves.
Absolutely. I want to put up some information here on behalf of the good folks at Cornerstone, and that is up on screen now. It's www.cornerstonehealth.com. You can get all sorts of good information and go see Dr. Elisabeth Stambaugh, Pinewest OBGYN, and you can, you're in High Point, right?
We do. We have an office connected to the hospital in the Heart Center, and also an office at the Premier Building, Premier and Wendover Avenue.
If I was a woman, I'd go to you.
Thank you.
I don't know what that means. We'll be right back after this.